Namaste. I'm Dr. Shwetha Anand. I'm a fertility consultant having more than 15 years of practice and plenty of IVF cycles to my credit. I practice in Janisthaa Fertility Center, which is situated in Basaveshwar, Nagar, Bengaluru. Age of a woman, very important question. Be it for normal pregnancy or for ovulation induction 1, IUI or for IVF. What happens in Indian scenario is after age of 28 or 29 and more so pronounced after 30 years, the ovarian reserve or the quantity of the eggs and the quality of the eggs starts declining. And after 35 years, the rate of decrease is even more rapid. So it is very important to start trying for pregnancy maybe when you are reaching about 28, 29, or if you want to push the pregnancy, maybe you should visit a doctor, consult whether you can push the pregnancy or not. After 35 years, because of the decline, there might be certain difficulties in conceiving. After 40 years, the chances of miscarriage rates, abnormality rates and the chances of conception also decreases. In India, we have maximum age limit of about 45 years. At 45 years, the chances of conception falls down drastically with your own eggs. With the help of assisted reproductive techniques, you can move towards pregnancy, but there are other methods of doing it.